So the next presenter is Vaishnavi Gengatheeswaran, and she's a fourth year medical student at the Faculty of Medicine, University of Jaffna. As a first-time researcher, Vaishnavi is focused on the knowledge and practice of contraceptive methods, and her presentation is on knowledge and contraceptive methods among reproductive age mothers attending a tertiary care hospital in the northern parts of Sri Lanka. Over to you.
Thank you for the introduction, sir. Very good afternoon to everyone. I'm Vaishnavi Gengatheeswaran, a fourth year medical student from Faculty of Medicine, University of Jaffna. I'm thrilled to present my study on knowledge and practice of contraceptive methods amongst reproductive age mothers who are attending a tertiary care hospital in the northern Sri Lanka. The first problem that we identified is that in Sri Lanka, even though the government and NGOs are providing a lot of services to enhance the usage of the contraceptive methods, still the unplanned pregnancies and unsafe abortions are in the higher rate. So we wanted to find that we are giving the service, why is not getting to the people? It's what is the problem between the knowledge and practice among them? So our primary object or general objective was to assess the knowledge and current practices of contraceptive methods amongst reproductive age mothers attending a tertiary care hospital in northern Sri Lanka. Our specific objectives were to determine the prevalence of contraceptive use amongst women, to determine the knowledge of side effects, contraindications, proper usage of contraceptives, to identify the socio-demographic factors, how they influence the knowledge and prevalence of contraceptive methods amongst women. So our methodology, the study design was a hospital-based descriptive cross-sectional study, and the study setting was conducted in the pediatric hospital and teaching hospital Jaffna, and the study population were the mothers who are aged from 16 to 49 who were staying at the pediatric wards at our data collection period. And the study period is given here, and we have excluded the mothers who of the critically ill patients, and we have excluded the repeated admission during the data collection period. Sample size was 389, and the sampling technique was systemic sampling method, and the study instrument we used was an interview administered questionnaire because there was some technical wording in the questionnaire. And the data analysis we have done in the SPSS 26 version, and in the results the total response was 359 with a response rate of 92.3%, and among them when we take the mean age, 33.7 was the mean age, and the age distribution of the participant and the partners are given in these two histograms. And in the socio-demographic factors, most of them were Hinduism followers with the 68%, most of them living in a nuclear family, and their education level, the most of them have education level above the GCE and the monthly income of most people is less than 75,000, and the occupation, if we consider each occupation person separately, housewives are the most common people, and the number of children the people are having 2 or less 74%. And almost all of the participants, that means the 98.3 participants, were aware of the concept of contraceptive methods. Amongst them, most of them show familiarity with condom, followed by oral contraceptive pills, intrauterine devices and injectable devices, and most of them got the contraceptive was given from an MOH office, and only 998 participants were practicing some type of contraception at the period of our study. And we assessed the knowledge of the contraceptive method using 19 questions in a questionnaire. The least score from 0 and the highest score is 16. The mean marks was 5.82, and the histogram is given here. And there are 198 people who were using contraceptive methods during that period. Among them, 21% were using sterilization, followed by implants, condoms, injectable contraceptives, oral contraceptive pills, IUCD, and the least of them are using the natural contraceptive methods or any other methods. 155 people were not using any contraceptive methods at that point. Most of them were due to the fear of the side effect. 34% not using any contraceptives because of the fear of side effects. Other than that, 23% are not even telling the reason. They don't know why they are not using any contraceptives. That is the main issue within this age group people. And then it is followed by the planning to have children soon, cultural religious belief, partner disapproval, and the least amount of people are not using because previous negative experiences and lack of awareness. Here the main thing we have to see is the fear of side effect is 34%, but the people who actually had a negative negative effect previously are only 3%. And when we are taking the users, when we asked about the side effects, only 52% had the weight gain, then followed by irregular excessive bleeding, and least amount of people are having headache or spotted bleeding or nausea or breast tenderness. So in the total amount of people who are currently using contraceptive methods, only 35.9% have ever had a side effect, and only 21 people are used the contraceptive pills, and most of them were, the reason was unprotected sexual intercourse. Some of them didn't know about that concept, and some of them have already used it as a regular contraceptive method as well, and only 6% have encountered a contraceptive failure. One thing is missing here, only 79.7% know that condoms can prevent the STIs. And the relationship between socio-demographic factor and the knowledge, when their education is higher than the GCO level, their knowledge is very significantly correlated with the p-value of 0.002. And when the monthly income is more than 75,000, there is a significant correlation with the p-value of 0.007. And when the occupation of the participant is other than being a housewife, they have a correlation with the p-value 0.046. In other factors, we expected to get some correlations, but we couldn't get. And the relationship between socio-demographic factors and the use of at least one contraceptive methods, when their children's number is more than 2, they are using more contraceptive with a p-value of 0.004. And when their monthly income is less than 75,000, there is a correlation with the p-value of 0.014. Here is a contraindicating factor. In the knowledge, when their income is more, they are having more knowledge. But when it comes to practice, when their income is low, they are having no practice. This is maybe probably due to they can't afford to have another child, or our healthcare assistants or midwives are more familiar with them to talk to them. And the highest education level, when the partner's highest education level is less than GCO level, that also have a correlation with the p-value of 0.032. And the other factors didn't have any correlation. In conclusion, even though the many participants have the knowledge or have the idea about contraceptive methods, when we ask about the in-depth questions, their knowledge is very poor, and there's a serious lack of knowledge regarding the emergency contraceptive pill as well as contraceptive used in the prevention of STIs. Next one is regarding the practices. The study revealed that a significant proportion of the population was currently using a form of contraceptive, and the failure rate is fairly low. So the people who are using are getting more benefit. And the study also highlighted the socio-demographic factors affecting the knowledge and practice of contraceptive methods. And our recommendations are, primary one is we have to give education on mainly 3 things. First one is the side effects of the contraceptive. In the side effects of contraceptive methods, it's really important to give that knowledge, as I told earlier also. And the knowledge should be given to the eligible couples, because in Sri Lanka, giving it a school education is not possible about contraception. So to the eligible couples, the education should be given by the healthcare professionals. And our second recommendation is steps must be taken to debunk the social taboo surrounding contraceptive usage at the community level. Because during the research, we found that they were ashamed of talking about the emergency contraceptive pill and STI. So the social taboo should be broken. And the other one is the incorporating modern techniques such as social media campaign will be beneficial, as it will attract more younger population. These are my references. Thank you.